This is a hard video for me to make, but I believe knowledge has power. HIV has a timeline, and knowing it will help guide you as you get treatment. In my case, I believe I was at least 8 years undiagnosed, and that has caused havoc with my body. At the time of the initial infection, most people infected with HIV experience a short flu-like illness that occurs 2 to 6 weeks after infection. After this, HIV may not cause any symptoms for several years. If HIV is left undiagnosed or untreated, the immune system depletes, making it much harder for the body to fight off infection. It's at this point that acquired immune deficiency syndrome, or AIDS, develops. If you delay treatment, HIV will continue to harm your immune system. Delaying treatment will put you at higher risk for transmitting HIV to your partner or partners, getting sick and developing AIDS. So, what happens if you have no reason to even consider HIV? In my opinion, if you've been sick and doctors can't figure out a diagnosis, an HIV test is a simple precaution to what could be a devastating illness like I've suffered. Let's talk about aging with HIV. As difficult as the topic is, I'll share research I've found helpful, but I'm also going to tell you what it's like to personally live with HIV and AIDS. One statistic I read in 2019, 34% of HIV patients were 55 and older. Compared with the general population, people who have received an HIV diagnosis are at increased risk of developing certain comorbidities. A comorbidity is a disease or medical condition that occurs at the same time as another condition. It can be that one diagnosis triggers another in time. As we age, we become more susceptible to age-related comorbidities that may reduce our quality of life. HIV causes significant inflammation in the body. This inflammation can damage the spinal cord and brain and prevent our nerve cells from working the way they should. Let's separate out some of the complications that are possible. It's a long list and terribly frightening, but knowing these may encourage you to make changes and live a healthier, longer life. Neurological complications may result not only from damage caused by the virus itself, but also from other side effects of HIV and AIDS, such as cancers associated with these diseases. Some of the drugs used to treat HIV and AIDS can also cause neurological complications while attempting to control the rapid spread of the virus. Certain genetic factors can influence the risk of neurological side effects from HIV medicines. Neurological complications don't usually set in until HIV is advanced, typically when someone has AIDS. About half of adults with AIDS suffer from neurological complications related to HIV, such as dementia, viral infections, fungal and parasitic infections, neuropathy, vacuolar myelopathy, psychological conditions, lymphomas, neurosyphilis, risk of stroke. Specific neurological conditions and complications are treated differently. Cancer may be treated with chemotherapy and radiation, and bacterial infections need antibiotics. Certain medicines may help manage viral infections, and medicines to manage pain can help to ease nerve pain. Counseling and medicines, including antidepressants, may be used to manage some of the psychological conditions associated with HIV. As of this time, I don't have any of these diagnoses, thank the Lord, but I suffer from chronic fatigue syndrome, and the HIV virus has been running rampant in my body for years, unknown to me. Cardiovascular disease. I have a genetic history of heart disease in my family and have been aware of the need to live a healthy life for years, but HIV has damaged my body and made me more susceptible to conditions that lead to heart problems, such as diabetes, high blood pressure, high cholesterol, and chronic kidney disease. Because of this, I take a statin and a blood pressure medicine as a preventative. One local HIV doctor I spoke to said every HIV patient over the age of 40 should take a statin. Liver disease. Liver disease is among the leading causes of non-AIDS related death in people with HIV. A co-infection of hepatitis B and hepatitis C viruses is common in people with HIV. When a person has both HIV and Hep B or Hep C, there is a faster progression to scarring and permanent damage of the liver, resulting in long-term liver disease and risk of liver cancer. Cancers. Lymphoma, a type of cancer in the immune system, and cancers related to HPV are also more likely to develop in those of us with HIV. Types of cancers related to HPV and the part of the body affected include cervical, the cervix, the organ connecting the uterus and vagina; vulvar, the vulva in women; penile, penis in men; anal, anus; oropharyngeal, age-related comorbidities. Not only do age-related comorbid conditions occur more often in people with HIV than in people without HIV, but they also develop at younger ages. Frailty, which is generally seen in the geriatric or older population, commonly occurs at an earlier age in people with HIV. Symptoms include weakness, exhaustion, decreased physical activity, and weight loss. Frail older adults are more likely to be admitted to the hospital and require long-term care. Osteoporosis is commonly seen in older folks. This occurs when the bones become weak, causing them to break easily. Osteoporosis is also common in people with HIV. Older adults are at a higher risk of falls as well, which is especially dangerous when coupled with the increased risk of osteoporosis and fractures. So why are people with HIV at higher risk? This is due to a variety of reasons, including the damaging effects of chronic HIV infection, especially if uncontrolled or undiagnosed, for many years; chronic suppression of the immune system; toxicity related to ART regimens. This is the medications you take, especially prolonged exposure to older therapies which were associated with more side effects; alcohol use, smoking, and drug use; obesity, low levels of physical activity, and unhealthy diets; ethnicity and gender. For example, Black men have the highest rate of cardiovascular disease in the U.S. Lower socioeconomic status. So that's a lot of bad news. So let's find some good news, my friends, with a caveat at the end. The life expectancy of people living with HIV and AIDS has significantly improved with the development of ART therapy in the mid-1990s. Those of us who are treated with ART can now expect to live into our 70s, provided we adhere to our ART regimen. For those who are motivated to take therapy, who have access to lifelong treatment, AIDS-related illnesses are no longer the primary threat. However, a new set of HIV-associated complications have emerged, resulting in a novel chronic disease that for many will span several decades of life. Treatment does not fully restore immune health. As a consequence, a number of inflammation-associated and/or immunodeficiency complications are increasing in importance. According to AIDS.org, untreated HIV can lead to AIDS within 8 to 11 years. People who develop AIDS without taking any kind of HIV treatment typically live about 3 years post-AIDS diagnosis. Go watch my very first YouTube video and learn how I found out about my diagnosis. You won't believe it. If I hadn't found out when I did, I would probably only have a few months left to live today. So how do those of us who are HIV positive live with these potentially life-threatening complications? One day at a time, my friends. I try to live the healthiest life possible, physically, mentally, emotionally, and spiritually. Counseling continues to help me come to terms with the shocking place I find myself in at the age of 61. A positive attitude may not cure me, but it sure won't hurt. So this is a lot of information, and if you have HIV, I don't want you to go out and freak out and Google everything that's on this list. I totally get it, and I have Googled all the things. I've talked to all the doctors, and I'm in a relatively good place. I feel good most days, and exhaustion is really the only thing that I'm battling. But I know I need to stay on top of my counseling so that I stay emotionally healthy. I know that I need to continue to exercise and eat healthy. I did give up sugar, so I have lost weight there. 1+ for me. Continuing to do these things, whether you have HIV or not, are a good habit to keep, because as we go into our older years, our body does change if we do not do the work to stay at our healthiest. We cannot keep Father Time from approaching, but we can have a positive attitude that our life is not over and the best is yet to come. As always, my friends, I'm sending hope and much love to each of you.